My name is Dr. Niemann. Just want to discuss with you Achilles tendon issues. So we get a lot of patients who deal with a lot of insertional Achilles tendonitis, where they formed a large calcified mass or calcification within the Achilles tendon. Also dealing with patients who have had gouty changes in the Achilles tendon, where the Achilles becomes thickened and weak and painful. Also dealing with patients who have acute Achilles ruptures or old Achilles injuries. In the long run, the Achilles can be repaired in multiple manners. Achilles tendon repair for acute ruptures are very commonly done. Most patients are outpatient, and you're basically just repairing the Achilles tendon. We feel that most athletes and very active individuals should undergo an Achilles tendon repair, and really it helps restore the integrity, the tension on the Achilles tendon, so you don't end up having weakness within the Achilles. Those patients who are dealing with chronic insertional tendonitis usually have a big, large bump sitting on the back of their heel, and it can be quite painful, okay? That is where the Achilles has become hard and calcified, and you can see some of the x-rays that we may have posted on our videos, that the Achilles tendon is just hard, calcified, and becomes very painful. For those patients, they can undergo a procedure where we remove the bump on the back of the heel, and then we clean up the Achilles tendon, and then we reattach the Achilles tendon. For those patients, they're about 3 weeks of not walking, and then 3 weeks of walking in a boot, and then about 6 weeks they're starting to do physical therapy. And I'd say most patients are really happy that they've done it, but it is a long recovery. When you understand the Achilles tendon, it is the power that you push with when you push off with your foot. So it is a good 4 to 5, 6 months of recovery where you finally get that strength back in the Achilles tendon. Other patients who deal with pathology within the Achilles tendon, there's a video that we showed of this gentleman who had a large gouty mass where the Achilles tendon had just been eroded by the gout that involved his Achilles tendon. Those procedures are done very common to the Achilles tendon rupture, where you end up cleaning out the Achilles tendon, repairing the Achilles tendon, and then their post-op recovery is basically like 3 weeks of not walking and 3 weeks of walking in a boot, and then they start physical therapy at 6 weeks. In the long run, Achilles tendons can be very painful, acutely, chronically. Love to visit with you and discuss some options. The surgical procedure is basically outpatient for all of these. In the long run, you're really able to return to most activities and live a pretty healthy life. And for some women who can't wear shoes with the back, or men who can't wear shoes because of the back or the heel just rubs, they're really able to return to most footwear and most activities without any complications.